Moving ahead now, rubella, also known as German measles, is an infection that mostly affects skin and lymph nodes.
It is caused by the rubella virus and is spread when people breathe in virus-infected fluids such as the droplets sprayed into the air when a person with the disease sneezes and coughs. It can also be passed through a pregnant woman's bloodstream to infect her unborn child. Rubella can be prevented by a vaccine.
In Nigeria, awareness on the disease is still very low and there is no rubella vaccine in the national immunization program.
Well, joining me now is the Assistant Director and National Measles Rubella Technical Working Lead at the Nigeria Center for Disease Control, Dr. Oyeladun Okunromade. Thank you for joining us on TVC Breakfast. Good morning.
Good morning. Thank you for having me.
You're welcome. Now, by way of education, I'm certain that a lot of Nigerians have not heard this name rubella and do not even understand what it is about. So educate us. What is rubella?
Okay, rubella, it's also known as a German measles. It's a viral infection. It is caused by rubella virus, which is usually transmitted by respiratory droplets from an infected individual. This disease is usually very mild and self-limiting. It presents with a very low temperature and rash, similar to measles rashes. But the thing to note there is that when this virus infects a pregnant woman, it has a very severe consequences.
Before we get to the pregnant woman, how does an infected person get infected? Because it is contacted from an infected person. How does one get infected in the first place? Okay,
so the infected person gets infected through this rubella virus, which is usually transmitted by hair. Oh. It's actually by hair droplets. And when an infected person sneezes or coughs, it can pass this infection to another individual.
So it's just in the air?
Yes.
Wow. And there is no carrier until someone inhales, takes in the air, and then it becomes infected. That's what it means?
Well, usually human is the carrier. And when it's in the hair, it has no effect until it's able to get a host.
Into the system.
Yes.
Now, talk to us. You were talking about how severe it can get when a pregnant woman carries or gets contacts this virus, so to speak.
So, rubella infection is usually very mild, and it presents in a very low temperature and a mild rash for any young individual. But when it gets to a pregnant woman, it has severe consequences because this virus has 90% chance of affecting the unborn child. Oh. So the effect is actually on the unborn child. So the child either comes with what we call congenital rubella syndrome, which is a multiple birth defect. And this presents in form of hearing loss, blindness, mental retardation, could lead to autism, and has a long-term disability effect on the infected child.
Wow.
So that is how severe
it is. And we hear
is.
that Nigeria does not have the vaccine, but it can be prevented, as it is said, by a vaccine, but there is no cure. Why is that? And if there's no vaccine, where do we begin? Okay,
so congenital rubella syndrome is a vaccine-preventable disease, and the vaccine is actually available, but it is only available to the elite. In the country, there is no vaccine in the national immunization program, which is usually free for majority. And the goal of Nigeria Center for Disease Control actually is to ensure that this vaccine is available to every individual. We're working with all our partners as well as our sister agency, NPACDA, to ensure that this vaccine is available at free of cost to all Nigerians.
All right, now, so why is it difficult for it to be treated in the first place?
So for rubella, once it has caused congenital rubella syndrome, it presents with multiple disabilities that can only be managed.
That's for
no prevention.
A baby?
Yes.
But in an adult?
In an adult, it's usually mild. It has no severe complications like measles.
Oh, okay.
So it is safe to say that rubella is a two-phase virus. On one hand, it is very, very self-limiting. It is benign and mild illness in any young adult. But on the other hand, if it affects a pregnant woman, it leads to a very severe but multiple abnormalities.
How can we now begin to detect it in terms of prevention now, or so to speak?
Okay, so presently, Nigeria Center for Disease Control has taken a bold step to ensure that we designate different health facilities across the country where we identify these cases on time and ensure that we collect samples for laboratory confirmation, which we're offering at no cost to all affected individuals. And we're going to ensure that we document all these cases to have enough evidence to establish the burden, the magnitude of this problem in the country, and advocate to policymakers for vaccine introduction into the national immunization program.
Absolutely, because a lot of Nigerians need to be educated.
This is not yellow fever or something.
Okay, thank you. Rubella is actually, the awareness is very low in the country because it's something that we're not really familiar with. And among the health practitioners, rubella is very, very low. Case detection is low, and that is why we're taking every step now to ensure that we increase awareness, first of all, among the healthcare providers, so that there will be a heightened suspicion. They will be able to pick it on time, as well as increase awareness among to the government, and also to increase awareness within the public.
How endemic is rubella in Nigeria, for instance, right now?
Rubella is actually with us in Nigeria. It's just that the awareness is very low, and there is no separate surveillance system to detect. The surveillance system is a system where we identify cases and detect and report some of these cases. There is no separate system for that. What we leverage on for rubella is measles. So every sample that we take for measles, if it's negative, then we go ahead to test it for rubella.
Well, what are the very visible symptoms of rubella? What makes it different from measles?
Okay, so measles is highly contagious,
okay,
and rubella is not as contagious as measles. And measles come with a lot of severe complications, especially in the young child, a very young child. But for rubella, you hardly notice any severe complications in young adults, except when it affects a pregnant woman. And rubella presents with mild fever, very low temperature. An individual can come with sore throat. They can have the general feeling of not awareness and not feeling well. And there is what we call malaise, kind of nausea and some other symptoms. And there is this classical rash, which starts from the face to the neck and extends to the other parts of the body, just like measles. And it is self-limiting. But it's very severe when it affects a pregnant woman in the first phase of the pregnancy. It comes with multiple disabilities.
So who is more or most susceptible to rubella disease or rubella virus? Those in the rural area or those in the urban area? Male, female, children, adult, old? Who is more susceptible to this?
Okay, so I would say every individual is susceptible to rubella virus as long as you are not vaccinated against this infection. But the risk of the transmission is actually low. It's more with a pregnant, when a woman in a childbearing age is infected. That is when the risk is actually heightened. A woman in a childbearing age that has not been exposed to the vaccine.
Now, talk to us about the availability of vaccine and the efforts to make them available and accessible to Nigerians, because we understand that is not available right now.
Yes, presently it is not in the National Immunization Program, and we are at Nigeria Center for Disease Control. We're working closely with our sister agency, NPHCDA, who has the mandate for vaccine introduction into the national program to ensure that this vaccine is available at free of cost to every Nigerian. And there is a systematic approach to ensure that we have new vaccine introduction into any national program. And this approach involves ensure that we have a systematic surveillance system where we'll be able to identify these cases and ensure that the laboratory confirmation is done, and we get enough data to guide, to show that we have the burden of this disease in the country, and this will serve as an evidence to inform policy to drive vaccine introduction into the country. And at Nigeria Center for Disease, we have the mandate to establish the surveillance system in the country. So we've taken a bold step to ensure that we have designated health facilities across the country, and these designated health facilities would ensure that they identify these cases on time and confirm the cases free of charge and ensure that this data is well documented, and this is what will give as evidence for vaccine introduction.
Okay, Dr. Oyeladun Okunromade, thank you so much for coming on the program.
Thank you for having me.
Right.
Joining us now is the Rubella lead for the U.S. Center for Disease Control, Dr. Gavin Grant. Thank you for joining us on TVC Breakfast.
Thank you. It's a pleasure to be here.
Right.
And also joining us is the Assistant Director and National Measles Rubella Technical Working Lead at the Nigeria Center for Disease Control, Dr. Oyeladun Okunromade. Thank you for joining us.
Thank you for having me again.
We'll start with you, Dr. Gavin. Talk to us about the partnership or the works you have had with the Nigeria Center for Disease Control. What has it been about?
Yes, so the US CDC works with different countries to help develop their programs, including disease detection systems, to detect diseases like congenital rubella syndrome. So like other countries, what we're doing, working with Nigerian CDC, is that we're just providing some technical support, is using our experience from other countries and establishing similar surveillance disease detection networks.
When you say technical support, break it down.
Okay, so technical support would be discussing how to set up these sorts of disease detection systems in hospitals. We have some experience in looking at the disease and some of the nuances of disease and how to detect these cases in hospitals, while the Nigerian CDC has a lot of experience in knowing what is the local situation and how would it work best within the Nigerian context.
All right, Dr. Okunromade, let me come to you on this. When it comes to training medical personnel to understand citing and the details of how or how it is manifest, how rubella manifests, how much of that is going down right now?
Okay, thank you for the question. So every average Nigerian doctor or medical doctor anywhere is well trained on the congenital rubella syndrome, but because it's not something that is very common, the awareness is not really high in the country. Doctors tend to miss the cases. But symptoms like congenital multiple abnormalities, like blindness, like deafness, like mental retardations, those are obvious clinical symptoms that they're very obvious. So for us, it's just to ensure that we increase awareness that when you see a child less than 1 year presenting with things like this, heart defect and all that, think of clinical congenital rubella syndrome.
When you talk about the issue of awareness creation, how much effort is going into the deliberate strategy to create this awareness?
Okay, so at Nigeria Center for Disease Control, we've taken both steps to ensure that we engage all the necessary stakeholders. We've engaged all the partners to ensure that we advocate for this congenital rubella syndrome. We've also developed a lot of guidelines, advocacy materials. All these are made available on our website, on ncdc.gov.ng, which people can refer to for further information. At the same time, we've worked with partners to develop a guideline for this surveillance system in disease detection that we're about to set up to ensure that we define different roles and responsibilities of the Nigeria Center for Disease Control, of the federal government, of the state government, of the NPACDA, which is our sister agency that has the mandate for vaccine introduction, as well as different roles of different partners.
All right, now let's look at the surveillance centers now. How many are we looking at? Because there are areas who are in the rural areas who would need all of this to have access to these places. How challenging has it been trying to, have the surveillance areas, working with hospitals and all of those?
Yes, in most places what we find is the hospitals are very open to working with NCDC and to develop these systems because they see the importance of having good disease surveillance systems. So initially we're going to start opening up 4 sites, and then we'll plan to expand to more sites in the future.
Where are these 4 sites going to be opened?
Yeah, so we're going to start with Luth. It's going to be the first site that we're opening this week, and then there will be other sites throughout the country.
All right, Dr. Grant, let me stay with you on this.
Sure.
Talking about prevention, which is the basic and knowledge people should have. When it comes to habits on a daily basis, what should people do to prevent rubella?
So rubella is a disease that usually about 70 to 80% of the population will get through natural infection. So it's a mild disease, and so people don't recognize it. So really the best prevention is actually going to be a vaccine, so that when you're exposed to disease, you don't get infected with the disease. And that's the major strategy that we use for prevention. Otherwise, it's something that's normally circulating in the society like a common cold. Right? So if someone's sick and sneezing, we should do the normal things. We should we should cover our cough and our sneeze so we don't pass it to other people. But these are the normal preventions that we would, and hand washing as well.
All right, Dr. Kuromade, now we talk about taking this to the rural areas. What are the plans? Because we found out that most of these areas do not really have access to medical health centers, so to speak.
Okay, so thank you for the question. There is a plan to take it to the rural communities, but the main goal of the detection for this congenital rubella syndrome is detection at the tertiary health facilities. So the awareness is to the rural facilities to ensure that when they see cases like this, they should refer to the tertiary health facilities for proper diagnosis and for early treatment.
Okay, Dr. Grant, the availability of vaccine that we don't have right now is much of a concern to Nigerians, because if there's going to be, because Dr. Kuromade said earlier, certainly there's rubella around, but people don't get to know much about it. But for those who are aware how to prevent it in the area of having vaccine, what are the efforts in ensuring that the vaccines are available?
Yeah, so, on the global level, there's efforts to kind of help countries introduce the vaccine by giving funding to introduce the vaccine, such as through the Gavi Alliance. They provide funding to countries. But usually the countries need to make the decision themselves to introduce the vaccine based upon all their program priorities, right? We have so many things that really need help throughout the world. So a country needs to decide for themselves, based on their priorities, what resources are available to sustain it and to introduce it. So it's left to the country to decide, and we can provide support for the country to help them make that decision.
All right, so I pick it up from there now for Dr. Kuromade. So what engagement are we having with the government to ensure that these vaccines are made available?
Thank you for that question. So for vaccine introduction into any national program, there is a systematic approach to that. The country needs to gather enough evidence, first of all, to establish that this is a major problem in the country.
Don't we have enough yet?
Yes, so the essence of this is to ensure that we have enough evidence by ensuring early disease detection, ensuring that we confirm these cases through laboratory confirmation, which NCDC is offering free of charge, and ensure that we have enough data. This is what we serve as evidence to policymakers. So we need to now engage the policymakers that this is a major problem in the country and we need funds for introduction of this.
In that evidence, like
we don't have enough yet.
Do we have enough evidence yet to say, okay, there has to be a proactive measure on this?
Okay, so this is the first time we're establishing a surveillance system different from measles for rubella. And this is what will serve as evidence of the burden of the disease in the country. What we have before in our surveillance system, there may have been a lot of missed cases. So you need to be able to defend the burden, the magnitude of the disease that you're presenting to the global world that you need this vaccine.
All right. Thank you so much, Dr. Oyelado Kuromade, for your time on TVC Breakfast. And thank you, Dr. Gavin Grant, for your time on TVC Breakfast.
Thank you so much.
Thank you.
Thank you.
Wonderful.
All right, let's tell you that the views and reaction of our resource persons on the topics discussed today are their views and have no connection with TVC News.
Oh, we must thank you for watching. You can keep up with us on social media using the hashtag TVC Breakfast.
Let's do this again tomorrow, Tuesday.
Bye now.
Bye now.
Have a great day.